Operation Flow is a plan to improve the way patients move through the system in NHS Lanarkshire in order to get the right patient seen by the right clinician at the right time in the right place, freeing up time for clinicians to manage patients appropriately.
The system has been under so much pressure over recent weeks, and we're looking to do a bundling of all the good things that we know work to help our system flow better all at once, to try to pull things together, reduce the pressure on the system and bring back a better experience for our patients and also importantly for our staff.
Over the past few months we've been observing the impact of overcrowding on our patients and on our staff, and I think Operation Flow is really important to try and ensure that our services become much more safer for patients, much more safer for staff, and also that it becomes an enjoyable place to come and work again.
Everybody's involved to a greater or less extent. There'll be parts of our health and social care system, particularly within our community, particularly in primary care, where our focus is on providing them to stabilise what they're doing, provide them breathing space to do the huge amount of work that they're already contending with. Within our hospitals though, it's about all of the staff in the hospitals with support about their community colleagues to identify some key areas where they're able to make some short-term improvements to again release some pressure so we can then focus on what happens next.
I would describe it as perhaps doing the basics well and doing the basics consistently. To staff who are going to be involved in Operation Flow, it won't feel as if we're doing anything brand new, but we'll probably be putting much more of an intensity into that process. So we know, for instance, that planned date of discharge is one of the key enablers which allows us to increase the flow through any health and social care system. We want to make sure that we do that to the best of our ability. The firebreak element of operational flow is putting a lot of effort in a short period of time into doing all of that. It may well be that we can't sustain that level of intensity for long, but we hope during the firebreak we'll be able to decompress the system and specifically bring hospital occupancy levels back into something which is more sustainable and indeed is safer with regard to patient care.
It's going to be happening across the whole of NHS Lanarkshire and across the two health and social care partnerships. It's important Operation Flow takes a whole system approach.
Operation Flow will help us decompress that gridlock and let people move through in the way that we want them to, so that they're in hospital for the shortest period of time, that is safe for them and that they can receive high quality of care in a timely way. And it's all about this movement, it's all about flow and getting people to the right places quickly and coming out of the other side. It takes the whole system to do that. And the benefits are for the whole system, for people, families and carers, and for our staff.
Some of these plans would have immediate effect. So if we can get more patients into the discharge lounge or pre-discharge, that means that the availability of beds is earlier in the day and patients are therefore not having to wait in EDs unnecessarily, and that improves their experience as well.
There's a huge benefit for all of our staff across the system in taking part in Operation Flow. We need to be able to give staff the headspace as well as the capacity to try best to make significant improvement actions that we know we require to make across the whole system. And by being involved in the firebreak to actually create that space and time, and then giving staff the opportunity to be involved in significant change, will make a big difference across the whole system.
It will make a significant difference if we could all pull together. The roles of each and every person in the organisation are really important, and if we do this initiative as one big push together, we can make a real step change.
We want to provide the best possible care for our patients, for our communities, for our families, so it's really important that staff support Operation Flow and we try and ensure that our services are the best for the people in Lanarkshire.
As Director of Quality, it's really important to get behind Operation Flow because this will make a big difference for our service users and the community. That's why I have allocated my improvement advisors to work with the teams on site to get the best possible outcomes. The quality improvement advisors will be using their skills and expertise, trying to make sure any changes that are made have a sustainability for long term.
I think the public need to have some assurance that we as a health and social care team are actually trying to improve the quality of service. And at the moment we recognise that the long waits that we're seeing in emergency departments, discharge arrangements to be put in place, these are all difficult things for patients and their families to experience. We've got to try and move beyond the current state of play and move to a position whereby we can improve quality and improve outcomes for everyone, for staff, patients and their families.
One of the messages we've had back from members of the public right across Lanarkshire throughout this period has been around, well, what's the plan to do better? What's the plan to get us out of the pressure that we're under at the moment? We've done a huge amount of work through the pandemic and through the uncertainties of the hardest winter on record. What we're wanting to really bring to the public's attention is the fact that we have had a plan, we do have a plan, and we continue to add in terms of those actions, and we really need their support to make sure that we're able to help them get the right care in the right place at the right time, for them to only come to our services when they need it, and to work with our staff in terms of the support and the advice and the guidance that they're provided. And critically, our staff have always been touched when the public have shown support and been kind and been attentive to them. That helps immensely. We're here to help the public. If they can help us, it goes a huge distance to helping us do everything better.